So today my topic is very short, okay? We'll be having only 2 slides. You have to draw 2 slides. I will explain. Today's topic is Norma. First one is Norma Verticalis and Norma Occipitalis. What is Norma Verticalis? Draw this one. Norma Verticalis means whenever we look at the skull from above. This is our skull. ऊपर से हम लोग जो देखते हैं that is our Norma Verticalis. And Norma Occipitalis whenever we look at the skull from behind. पीछे से हम लोग देखते हैं that is known as Norma Occipitalis. This is the occipital region, right? Norma Occipitalis. पीछे से देखते हैं तो फिर Norma Occipitalis. ऊपर से देखेंगे तो फिर Norma Verticalis. What are the parts? See, सामने वाला जो बोन है, this one. What is the first this bone? कौन सा बोन है ये? That is our front में है, तो कौन सा वाला बोन है ये? That is frontal bone, not frontalis. That is our frontal bone. Frontal bone. I will show. What are these two bones? What are these two bones? These are parietal bones. Frontal bone. Which bone is this? This is our frontal bone. पीछे कौन सा वाला है? These two are parietal bone. Parietal bone है. उसके पीछे कौन सा वाला है? This is our occipital bone. Now we have to know the sutures. See, which suture is this? This is our coronal suture. Coronal suture. Divides कौन सा बोन के बीच में है? सामने कौन सा है? सामने frontal bone. पीछे two parietal bones. This coronal suture, it separates the frontal bone and two parietal bones. This is your suture, lambdoid suture. Lambdoid suture. You don't. This separates which bone? Occipital और सामने parietal bone. सामने है कौन सा वाला bone? Coronal. Sorry, which suture? This is your coronal suture और पीछे है lambdoid suture. Okay. This point. Coronal suture and meeting point of coronal suture and which suture is this? Sagittal suture. This point is known as bregma. This one is known as bregma. And meeting point of sagittal suture and this lambdoid suture is known as lambda. This one is known as lambda. Okay. Now this coronal suture. Coronal means लैटिन में इसको बोलते हैं कि क्राउन लाइक. दैट इज योर करोनल सूचर. दिस वन इज सैजिटल सूचर. कम्स फ्रॉम द वर्ड सैजिटल मतलब एरो लाइक. देखो दिस वन इज सैजिटल सूचर एंड दिस इज लैम्डोइड सूचर. इट लुक्स लाइक द लैम्डा. फिजिक्स में पढ़ा होगा आप लोगों ने, राइट? दिस द लैम्डा. दिस इज योर लैम्डोइड सूचर. सी, जस्ट few centimeter behind the bregma there is a elevation, highest point of our skull, that is known as vortex. These two foramens are known as parietal foramen. ये दोनों का अगर if you add these 2 points, यहाँ पर जहाँ पर अगर मिलेगा, this point is known as obelion. O-B-E-L-I-O-N. obelion. ठीक है? parietal suture अगर if you draw a line जहाँ पर आके मिलता है, इसको बोलते हैं obelion. This point is known as obelion. What is the importance of knowing all these things? Just one simple importance. Can you tell me? Why is it important to know the diameters of our skull, various parts of skull? Why is it important? The size of our head with respect to the pelvic cavity. Can you tell me? वो तो है. Just I am trying to give you one very common example. Importance of the diameters of our heads with respect to the pelvic cavity. What is the importance? Life starts with that process. Normal vaginal delivery. This is important, right? अगर देर इज डिस्प्रोपोर्शनेट, द सर बड़ा है, पेल्विक कैविटी छोटा है, the head won't be able to pass through the pelvic cavity, right? बर्थ कैनल से नहीं आएगा, तब क्या करना होता है? Then you have to do the C-section, cesarean section, right? So again, what are the parts? This is your frontal bone, पीछे है two parietal bones, इसके पीछे है occipital bone. In between the frontal and parietal bone, this suture is known as coronal suture. In between two parietal bones, this is known as sagittal suture. In between the occipital and two parietal bones, this is known as lambdoid suture. Lambdoid suture. See, this view is this one. If you look it from the above, this is known as Norma Verticalis, right? See, सामने की तरफ थोड़ा narrower है, like पीछे की तरफ posteriorly it is थोड़ा bigger. So what are the sutures? This bone is, which bone is this? Frontal bone. Frontal, not frontalis. This is frontal bone. These two bones are parietal bone, and this bone is occipital bone. Occipital bone. Now suture. Whose suture is this? Whose suture? Coronal. Crown, like, right? Coronal. This is your sagittal suture. This is the lambda shaped. Which suture is this? Lambdoid suture. यहाँ पर होगा two parietal foramens, not shown in this specimen. Okay. Now few centimeter behind the bregma, there is this point is known as vortex. Vortex. Bregma कौन सा वाला है? This is the meeting point of sagittal suture and coronal suture. Meeting point of lambdoid suture, lambdoid suture and sagittal suture is known as lambda. Okay, these are the various parts of whatever we see in Norma Verticalis, right? Now comes the second slide. This is Norma Occipitalis. Done. See, this is the view that when we look at the skull from behind. Okay, what are these two bones? Parietal bones, right? Then this suture is, दो parietal bone के बीच में कौन सा suture है? Sagittal suture. Sagittal suture. And this is your, which bone is this? पीछे वाला occipital bone. In between the occipital and two parietal bones, which suture is this? It is the lambdoid suture. Can you see? This is the lambda shaped suture. Lambda shaped suture. This is your lambdoid suture, right? And this point is, what is this point? This is our lambda. This is the lambda. These are the parietal foramens. अगर दोनों को एक साथ कनेक्ट करेंगे तो फिर जहाँ पर मिलता है, this point is known as obelion, right? See, this one is sagittal suture, this one is lambdoid suture. There are two other sutures. See, this is your occipital bone, right? Look at me, this is your occipital bone. This is the, which bone is this? This is mastoid part, okay? So, which suture is this? In between occipital and mastoid. This suture is occipito-mastoid. In between occipital and mastoid. This will be occipito-mastoid suture. And this is the temporal. This is your mastoid. Which suture is this? Sorry, ऊपर है parietal, and this is your mastoid. Which suture is this? Yes, mastoid suture. Right. Adjacent to this suture, there is the presence of mastoid foramen. Mastoid foramen. Okay. There is the presence of mastoid foramen. See, here, there is a bony projection, swelling like thing. Whenever you palpate your head, this comes in surface marking. देखो पीछे की तरफ देखते हो ना, there is some swelling like thing. Swelling जैसा कुछ feel होता है. That is the external occipital protuberance. That is external occipital protuberance. Okay. This is the mastoid. Mastoid में कौन सा मसल लगता है? Attachment of, यहाँ पर कौन सा वाला मसल लगता है? स्टार्नोक्लिडोमास्टोइड सुना है ना? स्टार्ना और क्लेविकल से आके मास्टोइड में आके लगता है. right? This is the external occipital. This is the external occipital protuberance. और उसके थोड़ा सा नीचे there is another bony ridge-like thing. That is external occipital crest. External occipital crest. From external occipital protuberance there is a ridge going laterally, बाहर की तरफ, right? ऐसे, see. This is your external occipital protuberance. देखो, इस तरफ जाता है. This is known as superior nuchal line. Superior nuchal line. और उसके नीचे laterally from the external occipital crest, similar thing is present, that is known as inferior nuchal line. There is something known as highest nuchal line. This is above the superior nuchal line, but may not be palpable in all the individuals. This is very light or faint. Okay, these are the parts that we see in. These are the parts that we see in Norma Occipitalis. Norma Occipitalis. See, these are the parts. Which suture is this? Which suture is this? Lambdoid suture, lambda shaped, separates the, what are the bones? Two parietal bones, and this one is occipital. Which suture is this? In between the occipital and mastoid? Occipito-mastoid foramen. In between the parietal and mastoid? ठीक है? This is the presence of, this is the location where the mastoid foramen is present, adjacent to the occipito-mastoid suture. Adjacent to the occipito-mastoid suture. This is the area. This protuberance, this is known as external occipital protuberance. उसके नीचे आता है external occipital crest. External occipital protuberance से जाता है, that is your superior nuchal line. External occipital crest से जाता है inferior की nuchal line. थोड़ा ऊपर होना चाहिए, highest nuchal line, not visible. These are also not visible in this because this is not a real. Okay, so these are the things that you have to know from Norma Occipitalis and Norma Verticalis. This is a very easy topic actually. The important part, the most important part and the tough as well is the base of the skull. Okay, that you have to read repeatedly. You have to read about all the foramens and, ठीक है, वो पढ़ने के लिए I will suggest you to just read it from follow one atlas. Atlas पे दिया होता है. Take a printout and paste it on the wall. Otherwise, you won't be able to remember anything. Right? If you face any difficulty in these two things, you can come to me anytime. This is very easy actually. Nothing fancy in this. ठीक है?